My name's Professor Leslie Barclay. I direct the University Centre for Rural Health. The opportunities that students get with us are ones that you can't get in most urban settings. We have an opportunity for students to join teams, to become part of what's going on. You're not standing at the back of 25 or 30 other students trying to get a look in. You'll become an important part of a team of clinicians, be they doctors, be they allied health workers, nurses, or others. You will become part of our rural health clinical team.
So my name's David Gandini and I'm from the University of Wollongong. As part of the Wollongong program, we have a 12-month placement in a regional or rural setting. And so I chose to come up with my family as I'd heard of the great reputation for the teaching up here. It's also got good schools for my kids to go to, and it's also got fantastic beaches. As part of the Wollongong program, we spend 2 days a week with a GP doing parallel consulting for the whole 12 months that we're up here. And that's been a great environment to help develop the confidence to work autonomously as a medical practitioner. And I think that's going to serve me really well as I start my junior doctor years. So some of the best experience I've had is probably in the teaching that we've had up here. So the hospital here is big enough in that it's got lots of the specialties, but it's small enough in that a lot of the consultants actually know who you are and are keen to get involved in the teaching. So some of the formal teaching and tutorials, lectures that we've had have been fantastic. And then also the informal teaching that we get, whether on ward rounds or in theatre, in ED, has been great.
My name's Greta and I'm from the University of Sydney. I chose to come up to Lismore because I'd heard really good reports from students in the years above me, and I was keen to come to a hospital which was a little bit smaller because I think I have a tendency to get lost in the big city hospitals, and somewhere like Lismore's got a really nice sense of community in the hospital. I've also learnt that it's possible to have a really successful medical career not in a huge city hospital, because out here there are doctors who are top of their field but have chosen to work in a regional hospital, and so that really opens up a lot of doors for me. There's also been some really good social occasions up here. It's nice to see doctors and other students outside of the hospital and they know who you are, and that side of things has been really nice.
I myself came here as a young resident back in the early mid-80s and was somewhat changed by the experience, I think, and I've heard this from students as well who spend the year here. They're changed by the experience. Their perspective of life is broadened, their interaction with local community is different.
One of the things we're particularly proud of is recently, with the assistance of Health Workforce Australia, we've expanded our clinical teaching facilities. So we've got excellent facilities in Lismore, in Murwillumbah and Grafton, good clinical facilitation of simulation so that you can practice skills before you actually get into the clinical area. Some of you might be joining in lectures or tutes from your home university. We've got excellent IT support to enable you to do that.
Here at the UCRH we have this common area where there's heaps of computers and desks and lockers and everything like that. So if you've got some time off from the hospital, you can come over here and get some study done. All the staff are also based here, so it's really easy to chat to people or get help when you need it.
We're also blessed in this area with some beautiful geographical features, and the students have a great chance to enjoy the environment, enjoy the eclectic mix of people and culture that we have here.
My name's Sam and I'm from the University of Western Sydney. For a while now I've been tossing up whether or not I want to do rural after I graduate. So I thought, why not give it a crack at the moment? We're reaching the pointy end of medical training, so we have this opportunity given to us by the university to come up and spend 10 months in the Northern Rivers. Why not take the opportunity, come up and relax by the beaches, meet some awesome people while you do it. So at the moment I'm on a GP rotation, so I head off to Casino in the morning. So the other day when I got out there, actually we headed straight back to Lismore and delivered a baby girl to a lady whom the GP had also delivered. Where else bar rural area can you sort of get that experience where this guy has 3 generations of women all in the same room that he's cared for throughout the time he's been working as a GP in Casino, so that was really fantastic.
The GP that I'm on placement with, he works at the Aboriginal Medical Service here in Lismore about once a month. So I get the opportunity to go and see the patients that come into the AMS. And my doctor that I'm with, he's a great advocate for Indigenous health, and so he's well respected by the community. And that then allows me to be involved in that community and get an understanding of the issues.
I really enjoy directing the University Centre for Rural Health, and part of my enjoyment is not only being located in a great place, working with fantastic clinicians and doing research that actually helps improve rural health services, but we've got great staff. If you come and do a placement with us, I tell you, your coordination and your clinical staff who are looking after you are out of the box.
If you're a student thinking of coming up here, it's got great teaching, the surfing's great, so get up here.
Grab the opportunity with both hands and run with it. It's really a fantastic place to come up and experience. It's a fantastic time and you won't regret it.
I would definitely return myself if I could, and I'm even contemplating coming back as an intern because I've had such a great year.
I'd have little doubt at all that the students who journey with us for the year here, I know that they do well in their academic programs, but more than that, we are hopeful and confident that they become better people and better doctors as a result of their time here.